Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. Today, we're going to be talking about multiple sclerosis. But before we get to that, we're going to see what Dr. JJ is taking today.
Okay, this fits very well with multiple sclerosis because I'm going to talk about one of the most important interventions in multiple sclerosis, which is a fish oil or fish. So I will take a nice little gel capsule of fish oil right here, an omega-3. A lot of you know these as omega-3. I believe this one is halibut. You could also get it from cod. You could also get it from sardines. But this one right here is halibut, and that's it. That's the fish oil right here.
Awesome. Now, you can get different intensities of omega-3s. Is it the DHA or EPA?
For the central nervous system, so the mind, the nerves, etc., DHA has more of an affinity for that part of the body. EPA tends to more of an affinity for the heart. However, you should always take them together because we find that you do need both regardless. However, some tend to have a bit more of a concentration of one versus a concentration of the other.
Oh, very good. So tell me, what is MS or multiple sclerosis?
Okay, so MS, multiple sclerosis, is a progressive disease. It's a very serious disease. Some believe it's autoimmune in nature. We're not entirely sure, but we're trying to understand how it happens, where basically the wrapping around your nerves gets attacked by the body, hence the autoimmune nature. And with that causes a bunch of problems. So as you unwrap the wrapping around the nerves, just imagine if someone would strip the outside of a garden hose, well, you have problems. So this interferes with the signal transmitting through the nerves, and you could have a whole array of symptoms. So you could have trouble moving your arms, you could have trouble walking, you could have trouble with balance, muscle weakness. Also, a lot of patients get vertigo and dizziness. It can affect your ability for cognition. You can end up in a wheelchair. If the nerve supply to the bowels or the bladder is affected, you could accidentally lose bowel control or lose bladder control. So it's varying depending on where the nerve is affected. It's a very serious disease.
What causes MS?
We're not entirely sure what causes MS. We know there's a genetic component. So if you have a family member who has MS, then you may be prone to MS. What we found is that people who live in boreal climates, so people who live at higher latitudes, are more prone to MS than people who live at the equator.
Wow.
And we believe that's due to sunlight. So it seems like people at the equator, because of sunlight exposure, tend to have MS less than people in higher latitudes. So there's a component there. There's also viruses. So for example, the Epstein-Barr virus, if you've had an infection of that could predispose you to MS. Environmental toxins. Also, there's been some issues. Some people have wondered, maybe mercury from fish or mercury from fillings in your mouth. There's some conflicting evidence if that's related to MS or not.
Wow. Is there anything that we can do to prevent it, or?
Well, if it's genetic, you definitely have to be careful for that. So on the prevention side, it's also good on the treatment side. There's something called the Swank Diet, which is pretty much a diet very high in omega-3 fatty acids. So these are the fatty acids you get from fish, particularly cold water fish such as cod, halibut. That's where you get those omega-3 fatty acids. That's very good. Vitamin D would probably be top of the list with respect to treatment and prevention. I've had a few patients now that have gone on vitamin D at very high doses. I won't tell you the dose because you should be monitored for this. And we've had very, very good effects. So vitamin D is key for MS.
Yes, because I think I remember reading an article in the Toronto Star that talked about a study that was here in Toronto where they were giving high doses of vitamin D, and I think it was for MS.
Correct.
And the units were in the thousands. It was incredible how much they were giving people.
Yeah, it was very high, and it was generally well tolerated, and the patients I had in that study all did very well, and they've continued at a high dose. But this is not something you should do unfollowed. You should be followed for this. Yeah.
Well, if anybody suspects they have MS, they should definitely find a healthcare practitioner to work with, a medical doctor. And
correct. And anybody who has MS has to go through a neurologist. They'll do an MRI of your brain to look for amyloid plaques, etc. So you want to make sure you have a diagnosis of MS. But if you have a family history of it, definitely vitamin D would be something to take, and fish oil would be something to take to prevent the disease.
Awesome. Very good. Well, if you wanted to find a practitioner to help you on a more natural approach to treating the disease. You can go to the Find a Practitioner link on our website at vitaminjunkies.com, and don't forget to subscribe to our videos there as well.
And while you're there, please fill out our survey because we want to hear what you, the listener, would like to see on our show. We're always open to hearing some show ideas, so when you fill out the survey, you could win a chance to get $100 of gift stuff from Hey Jute. So go to www.vitaminjunkies.com.
Thank you so much for joining us today. I'm Jennifer Lyle,
I'm Dr. JJ.
and let's continue the addiction to good health.
Do, 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 do. Do, 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 do. Do, do, do.